It's the Pain Exam Podcast with your host, David Rosenblum, MD. If you treat pain or have an interest in pain management, join us as we discuss painful disorders, alternative treatments, practice management, and more. Be sure to subscribe to the Pain Exam newsletter at painexam.com and review the podcast on Stitcher or iTunes. Our high-yield premium episodes are now available on the Pain Exam app with a premium subscription or access for free with a CME subscription at painexam.com. And now, without further ado, here's your host, Dr. Rosenblum.
Welcome back to the show. Today, I wanted to talk about peptides because that's all the hype I'm hearing about. Everybody is sick of the insurance companies and wants to augment their medical practice, whether it's for pain or for other reasons. People are looking at the regenerative medicine, the hormone therapies, the IV infusions, and today I figured I'd find out more about peptides since there's a lot of hype about this. I'm not currently prescribing them, but I just want to know more before I consider doing something like that. So I did some searches online to get educated and found some interesting stuff. I'm going to share the links on the show notes. Some of this is super in-depth science back to biochemistry, and I'm not going to spend too long on that because that's just a very, very long lecture, and I'm sure you could just read it for yourself. I'm going to try to give you an overview, which some of these links are from actually people's practices where actually they summarize things better than Google. So I'm going to just give the link to you and you can check it out for yourself. And I'm going to try to focus more on things in the realm of pain or overall health that relates to pain. So I'm not going to spend too much time on the anti-aging, the skincare. But I will talk about what I see here for anti-anxiety and depression, and they have a substance called RG3 methylcobalamin NAD, nasal spray, and this is basically B12 methylcobalamin. It enters the body through food supplements, and B12 can support nerve cells to function normally and is important in DNA synthesis and the formation of blood cells. Overall, the vitamin offers energy-boosting effect, and it can also help in prevention of heart disease and improve memory. They list that under their psychiatric, the anxiety and depression realm. Selenk nasal spray, never heard of this stuff. They say that this is actually a regulatory peptide that is vital to the nervous system's formation, development, and effective functioning. It does have anti-anxiety properties. Once again, I'm going by what they're saying. I don't have the academic reference. I don't have time to research every one of these little things, but I figured I would just tell you what they're touting about this. It works as a neuropsychotropic, according to a study on how Selenk administration affects the expression of some genes involved in GABAergic neurotransmission. This was in Frontiers in Pharmacology, they're quoting. It also functions as an antidepressant, according to them. The peptide has been further shown to facilitate learning and memory. There are other peptides. I'll go down the list. The AOD 9604, the advanced obesity drug, stimulates the body's natural occurring human growth hormone in its regulation of fat metabolism. Unlike HGH, AOD does not carry negative effects on our growth or blood sugar. The peptide aids in improving metabolism and reducing fat. So I wonder what the side effects are. They don't really mention that. BPC 157, there's a study promoting, remember, a study. It doesn't mean, it's just one study, they're saying. Promoting effect of pentadecapeptide BPC 157 on tendon healing in the Journal of Applied Physiology. Reports that it speeds healing of wounds in the nervous system, tendons, and muscles. It also accelerates the healing of skin burns by increasing circulation to tissue that has been damaged. BPC 157 may also may support joint healing and cognitive performance and help with GI issues like irritable bowel disease, urinary incontinence, and stomach ulcers. Once again, guys, I'm just reading what they have on the various websites. I'm not claiming anything about these substances, and I'm not doing an in-depth study as to their or an in-depth comment as to their side effects. I'm just trying to get an overall lay of the land because I don't know much about this stuff, but it may be the way of the future. I know a lot of people are doing this already, and if it could help our patients, I'll check it out, right? Why not? This is a CJC 1295 with pamarelin. It's a 30 amino acid peptide. CJC 1295 increases the synthesis of proteins, resulting in simultaneous effect of fat loss and tissue growth. Peptides benefits may include increased energy, protein synthesis, lean body mass, and bone density. CJC 1295 may also improve immune defenses and sleep quality, as well as speedy recovery from injury. Well, you could also just take broccoli, I guess. Dihexa, this is a subset of angiotensin 4 related molecules. It possesses procognitive, and anti-dementia properties. It binds to hepatocyte growth factor and increases the activity at its receptor, c-Met. The compound has been found to potentially improve cognitive function. GHK-Q. It's a tripeptide naturally present in human plasma and many tissues. As a copper peptide, the protein fragments attract copper ions, which play critical roles in the normal functioning of the human body. The peptide attracts immune cells while also stimulating glycosaminoglycan synthesis. It can increase production of mRNA and other proteins, thereby facilitating tissue maintenance and repair. It can also produce antioxidant and anti-inflammatory effects, remove damaged tissue, proteins, reduce infections and heal wounds, lower nerve damage and pain, boost skin collagen production by 70%, reduce wrinkles. It also protects the body against liver fibrosis and serves as anti-cancer therapy. Unfortunately, there are not many references to support all this stuff that I'm reading here. So just keep that in the back of your head. But these compounds I'm seeing across the board on multiple websites. I just chose one that that really summarizes it quite well, or it's made mainly for patients, not for clinicians like me and you. But I need to kind of, like I said, get an overall lay of the land here because this is still new to me. Ipamarelin, I'm not even sure if I'm saying that right. It increases plasma growth hormone levels, binds to the body's growth hormone secretagogue receptor in the brain, kidneys, heart, GI tract, liver, immune cells, adipose tissue, and pancreas. It may improve cellular repair, sleep quality, increase collagen production, energy, and endurance. And it can also decrease appetite, stimulation, and reduce production of cortisol, prolactin, and aldosterone. Look, if you're one of these people who's been trying to diet and nothing works, maybe these things are the right choices for you. To be honest, there's a lot of them, and it could be overwhelming what to do, where to go, and what's safe. I am hearing some positive reports on peptides from clinicians I work with. So it's nice to know. Anytime even with PRP and all that stuff, I took a while for me to jump on the bandwagon because I wanted to make sure that it's not just a gimmick or money maker. And PRP turned out to be, at least from my understanding, to be a money loser because it actually helps people get better and move on with their lives. So anyway, there's another one, MK677, ibutamoren, and it may improve cellular repair, sleep quality. Remember, be careful when they say it may do this, it may do that. I mean, that's not here nor there, right? If you're watching that painkiller show, which you should watch, especially if you're in the business of treating pain, you have to watch this. there's that part where they go to the FDA and they say that oxycodone is believed not to be addictive, something like that. And then they highlight the letters in believe, the words LIE in the center, which mean lie. So when people use these words, you want to see, obviously, studies show this, and they tell you what type of study and the quality of the data, etc. So you can figure out yourself. PT 141 helps both men and women enjoy more satisfying sex lives. Okay, be careful when you hear that stuff, right? So the peptides address the problem of erectile dysfunction. PT 141 stimulates dopamine hormones to boost the nervous system's ability to achieve sexual arousal. Then there's CMAX. It can provide efficient prevention and treatment of circulatory disorders, may treat stroke, memory, cognitive disorders, peptic ulcer, optic nerve disease, and boost immune function. It rapidly elevates brain-derived neurotrophic factor and its signaling receptor TRKB in the hippocampus. It's been found to produce antidepressant-like effects. Sermorelin is hormone-releasing factor to encourage HGH, testosterone, and other hormones. They say that it will increase stamina, energy, texture, muscle mass, improved mental function, focus, concentration. Thymosin alpha, there are reports that it modulates the immune system, downregulate progression of melanoma, breast cancer with prolonged half-life. The protein is used, and there's a reference here to the link that says that. The protein is used to boost the immune response to various to the treatment of various diseases, and it has the potential for treating lung cancer, respiratory complications, and septic shock. I wonder if that's in the ICU. Thymosin beta 4 is made up of 43 amino acids present in tissue throughout the body. According to research on the structure, function, biological properties supporting current and future applications of thymosin beta 4 published in the Annals of New York Academy of Science, protein has been found to facilitate tissue regeneration, the formation of blood cells, the survival of cells, and a host of other functions. The application resulting from these roles suggests that protein can benefit in the treatment of lung inflammatory disease, as well as complications related to CNS and sepsis. So I basically summarized a website for Health Gains. I don't know them, and I thank them for laying out all these different compounds, which they don't mention any side effects of the peptides. You might need to talk. They offer a free consultation. So I don't know these people. I just found them on a random Google search, but I'm trying to figure out, is this something I want to do in my practice? Is this a future? It may be the future, especially if these studies turn out to be positive. I'm providing another link in the show notes for you geeks out there who really want to delve into the science and have maybe 2 or 3 hours to read this thing and another 6 hours to try to understand the biochemistry here, because I'm looking at this paper. It's super long. It goes really into the peptides, which, by the way, this reference talks about the top-selling non-insulin peptide drug sales. They have a chart from 2019. The dulaglutide and the liraglutide and semaglutide are creatide. These are like the top-selling peptides. And actually, these are the ones I've heard about. The ones I just read you from this other link, they're new to me. So I'm not really a weight loss doctor. I'm a pain doctor, anesthesiologist. And so I really am just figuring out, is there a place in my practice for this stuff? I know a lot of you are already doing this and can probably school me on this, and that's great. I'm looking forward to learning more, because if it could help the patients and it's safe, why not, right? Thanks for listening to me ramble about peptides. I do hope that you guys caught me at Aspen's Young Innovators, where we did some board prep. I'm going to be doing more or providing more content for Aspen, hopefully in the near future. And I am transitioning pain exam to the virtual pain fellowship. The old site's still there and everything's still up to date on that, but I'm adding a lot more new content to the virtual pain fellowship or the NRAP Academy site. So just go to nrappain.org and you could click on the pain management tab where you will see either an option for the virtual pain fellowship, which is just comprehensive, almost everything you could think of learning for pain management, plus the options for just a regular pain exam question bank or the on-demand ultrasound or regenerative pain medicine training. Thanks for listening. I really appreciate you guys. If you have a moment, please give us a rating, a review. If it's a bad review, well, just tell me. Don't do that. If it's a great review, please leave it. I would really appreciate that. This is a labor of love. These podcasts, I get paid occasionally when we have a sponsor, but for the most part, they're all free. So enjoy. Thanks.
Dr. Rosenblum is here solely to educate, and you are solely responsible for all your decisions and actions in response to any information contained herein. These podcasts are not intended as a substitute for the medical advice of a physician to a particular patient or specific ailment. You should regularly consult a physician in matters relating to yours or another's health. You understand that this podcast is not intended as a substitute for consultation with a licensed medical professional. Copyright 2017, David Rosenblum, all rights reserved. No part of this publication may be reproduced, stored in a retrieval system, or transmitted in any form or by any means, electronic, mechanical, recording, or otherwise, without the prior written permission of the author.